that was a lot, okay? Let me give you all another update as to what's going on with me orthodontically. So while I wait to do this tunnel graft, Dr. Nuaz has also got me rigged up with some orthodontics to help me start getting my occlusion back even before I do the SFOT later on. That's going to allow me to expand aggressively. So he's actually working with Dr. Ting, a very, very, very experienced and very active MSE provider in Southern California. Dr. Ting, you could say, is the best of the best. He's the godfather of the MSE. I know Juan Moon is considered, you know, the king, but Dr. Ting is definitely the godfather because he has done over 250 MSE cases and he's seen it all, man. And he is just a proficient MSE master and also a master of TADs in general. So he worked with Dr. Nuaz to devise a system of TADs that are screwed up on my upper left side where I have this asymmetry from my MSE expansion. Let me step back for a second. So my MSE expansion was not only put me into a Brody bite in general, which means that I was so wide that I couldn't have any contact of my teeth. It did so mostly on the left side, not so much on the right side, because what happened with my MSE treatment is that a lot of my expansion was unilateral, which means that it was more, I expanded more on the left than on the right. And so what we're trying to do is, and what the CBCTs show is that a lot of what happened on my left side is that, or what can be done to correct that on my left side is to just torque in the teeth. That means to pull the left side teeth, to tilt them back in toward my tongue. So that, I guess, would be called lingual torquing. In addition, we have a maxillary cant that I've been dealing with since my time with AGA and controlled arch. For a lot of my more long-term followers, you'll remember that as early as December 2018, I was concerned about this cant that I had, which means that my maxilla is actually tilted like this. So what I've got going now is a system of elastics in TADs that are torquing my left upper teeth lingually, which means pulling them like this, tilting them in to try to get me back into a good bite on that left side. And we're also intruding those upper left teeth to correct the cant, which means we're pulling them up into the bone using the two TADs. So we're intruding those upper left teeth so that the smile goes more like this. Here's the upper left teeth being intruded. Boom, gets that nice flat smile. And I'll just give you a glimpse of what that system looks like. So you can see a TAD here and then another TAD up here. And you see those triangles? They're connected to my upper left teeth to intrude them, to pull them up, to pull the teeth up into the arch. I'm sorry, into the ridge. And then I also have my MSE still in my mouth. And an elastic going from these teeth to the MSE to pull those teeth in. I hope you saw that. One more time in case you didn't. And then, as you can see, I also have Invisalign trays in. Okay? My teeth look probably a lot better than they did the last time you saw them. Less diastemas between the teeth, because even though I'm not using my Invisalign aggressively because my front teeth can't handle an aggressive Invisalign use, I am swapping my trays out every, let's say, 2.5 to 3 weeks, which is very slow for Invisalign. Invisalign allows you to go as fast as, you know, replacing your trays once a week. I'm doubling or tripling that just out of precaution to make sure that I go real nice and easy with my damaged upper front teeth. But I have been slowly working the Invisalign for the past 3.5 months. So that's pretty much my update. Slow but steady. Got ridge augmentation scheduled for the end of May. I got Dr. Nuaz and Dr. Ting working as a team to wrap up my case, put a ribbon on it. I mean, we're not even close to that. We got a while to go. But they've got this cool system of TADs and elastics going to help me get some occlusion back. Once my tunnel graft heals, then I will look into an SFOT type ridge augmentation on the lower and a little bit on the upper right to try to get that expansion that I need to bring myself into a nice final form. And that's about it for now. One other thing, and I'll be doing some videos on this soon, I've also got a face mask coming. The Crane face mask. From the very kind inventor of that device down in North Carolina. I'm acquiring a crane, and I'm going to be using it only on my right side because, again, I had this unilateral MSE expansion, not totally unilateral, but largely unilateral. And not only did my left side come out more transversely, but it also came more forward. Okay, so my maxilla is a little bit kind of slanted, like this, where the left side is more forward than the right side. So I'm going to use the face mask to pull just the right side forward, like this. So literally what I'm going to do is I'm going to connect the face mask via an orthodontic elastic, excuse me, to the back right TAD or screw head of my MSE itself. I cut the hooks off, the face mask hooks off my MSE, but that's fine because what you can do is you can connect a face mask directly to the MSE itself. And I've already been experimenting that with my crappy standard face mask that connects here and here, but the new face mask I'm getting, the Crane, anchors onto the neck and doesn't put as much pressure on the mandible or on any part of the face really. So I'm looking forward to slowly teasing that right side of my maxilla forward to get that nice even maxilla. Meanwhile, we're correcting my can't get in shit flat, and slow but steady wins the race, man. Orthodontics is about pressure and time, right? Shawshank Redemption, for anyone who hasn't seen it. Pressure and time. Chip away at it, and that's exactly what I'm doing. I'm hanging in there, and yeah, orthodontics, it's complicated, it's messy, a lot of it sucks. COVID-19 sucks, right? It definitely threw a wrench in my plans, slowed things down for a lot of people, not just me. But we'll get across the finish line. When you have a provider as awesome and as patient and as open-minded as Dr. Nuaz, and you have an all-star on your team like Dr. Ting, and you have a stud team of periodontists, who I will name later, working with you for tunnel grafting and SFOT, and you've got an awesome face mask inventor who's supplying you with a dope piece of equipment, and you've got patience, and you've got grit, and you've got an attitude to not give up, and you keep the rest of your body healthy, even if your occlusion is a little fucked up for a while, then good things happen. Slow but steady wins the race, folks. So that's it for now. And let me know what y'all want to know more about, because school is ending on May 6th. I'm wrapping up my post-bac pre-med studies. I'm not going to dental school, at least not this year. I've got some other stuff going on for income, working, doing other things. Not going to go to dental school, so hoping to put out some more content soon. Let me know what you want to know about in the description below. I'm sorry, in the comments section. And I'll holler at y'all soon. All right, be easy. Peace out.